Good evening, everybody. I'm Sayukta from Prostate Wellbeing Team, and I'm sure all of you must be keeping good health. Today, we are going to discuss a very important topic, renal calculi. Renal calculi, commonly known as kidney stones, are hard, pebble-like pieces of material that form in one or both of our kidneys when high levels of certain minerals are in your urine. Kidney stones vary in size and shape. They may be as small as a grain of sand and as large as a pea. Rarely, some kidney stones are as big as golf balls. If you have symptoms of kidney stones, including severe pain or bleeding, seek care right away. A doctor, such as a urologist, can treat any pain and prevent further problems, such as an urinary tract infection, commonly known as UTI. So, to throw more light on the subject and guide us on what's right for diagnosis and treatment of renal calculi, today we have with us renowned urologist Dr. Arjun Prakash, MS, M.Ch. Urology. He has a rich experience and hands on expertise in urology, BPH, and stone management. He is currently practicing at Chandana Urology and Kidney Center behind Joya Lucas, 18 by 1, Arundalpet, Guntur, Andhra Pradesh. Dr. Arjun Prakash has rich experience in the field of urology, carries out the renal calculi diagnosis and treatments with utmost precision and efficiency, ensuring that patients' health is in safe hands. A very warm welcome to you, Dr. Arjun
Thank you.
Prakash.
Thank
So,
you.
doctor, as today
Thank
we
you
are
for the
going to
introduction.
talk as today we are going to talk about kidney stones, and kidney stones are quite common in our society. So many times people don't know about it, don't know the consequences if right treatment is not taken at right time. So there are so many doubts, and we will try to answer those or satisfy those questions in today's session. So first of all, doctor, what are kidney stones?
These renal calculi are kidney stones, which commonly used. The term is kidney stones. That means it's used to denote the stones which are formed in the either in the complete urinary tract or the kidney. The urinary tract means kidney, ureter, bladder. Comes like this. The kidney, the pipe which carries the urine, the ureter, and this is the bladder. Stone may form anywhere in the kidney or ureter or bladder. These commonly we call kidney stones, but it depends and varies depends upon the location and how are they formed, why are they formed. These are hard crystallization of the minerals. Due to the hard crystallization of the minerals in the urinary tract due to the taking of different food and water, these are formed in our kidneys. So there are different minerals like these stones can be of different textures like calcium stones, they call steroid stones, mixed stones, which are formed in different infections, urinary infections. Uric acid stones. These are mostly formed in people who take more of protein, animal protein, or some genetical disorders, and also cystine stones. And the stones, these are the various types of stones. And to the crystallization of these minerals, these hard things form in the urinary tract, in different places of the urinary tract. These things are called kidney stones, and most commonly we see in the summer season.
Just mentioned, doctor, that in summer kidney stones are more common, and one of the reasons definitely may be that we drink whatever we drink, it goes out in sweating, or we don't drink enough or adequate water. So we would like to
Yes.
talk about the causes. You have already stated, you have already mentioned that there are various factors which can contribute to kidney stones. What you are eating, what you are drinking do impact. So, we would like to understand why in summers there are more cases of kidney stones and what should we do to prevent it.
These kidney stones are mainly seen in summer due to dehydration. So what we should do? We should improve our water intake. And the most common question in our regional language, they ask how much water we should take to prevent these kidney stones. The simple answer is it's not how much water you should take. The minimum urine output should be 2 to 3 liters. A person sitting in home can drink 2 to 3, around 3 liters of water, it will be enough. A person going out in the scorching heat, he should take around 4 or 5 liters of water because he will be sweating profusely and getting the more chances of getting dehydrated. So so that you should maintain adequate urine output. When adequate urine output is not there, what happens is these minerals can't get diluted in the urine, and it tends to form stones more frequently. There take more water in this bottle of water with you wherever you go. And another thing is you should what you should do is decrease the intake of animal protein. That is, who eat meat regularly. What? Or else what happens? The uric acid in the meat forms. Another is you should decrease your dietary sodium. The sodium levels should be decreased. The increase in the dietary sodium is the most common cause of all. And the foods rich in oxalates, that is the one of the main causes of stones. Another is family history of stones. Some genetic problems will be there, which will mean where they have the tendency to form stones. That is also one of the main reasons. And some medicines are also associated with the stone formation. So you should frequently visit your doctor to change your prescriptions when such medicines are there. And another thing, obesity, diabetes, which are more prone to infections and recurrent urinary infections. These urinary infections is also one of the main reasons for formation of steroid stones, which are called infection stones. Due to the turbid urine and crystallization, that stones will be formed in the patients having these diabetes and UTI and recurrent infections. These are the few causes, and the most common prevention measures which a patient can take is to drink adequate water, limit the animal protein, limit the salt. These are the main things which he can do, maintain proper body weight.
Right. So this is what we can do in preventing kidney stones. But in case we have these symptoms, we need to go and consult a qualified
Yes,
urologist and get it treated. Now,
yes,
talking about these symptoms, doctor, because people normally say that when you have pain due to kidney stone, it is one of the worst pains one can have. So, what are the
yes.
other symptoms, and what should we do?
When you have these symptoms, which I say, the most common symptom is this excruciating pain. That pain, are you able to hear me? Yeah, the pain which comes from the loin, the area in the back beside the spinal cord, to groin, to your scrotal area. It radiates from back to the front, and the pain comes in cycles. It won't be a continuous pain throughout the day. You experience that pain for a period of 5 minutes, but it's a very severe pain. It's a very severe pain, excruciating pain from loin to groin area. And the patient, along with the symptoms of pain, will have the symptoms of nausea, the feeling of vomiting, sometimes vomiting. These things will be there. And he also might have some blood in the urine. He also will have, there is some up stones, chills and fever. Chills and fever. Some blood in the urine might be there. And one important symptom when the stone gets struck in the ureter, the pipe which I showed is stranguria. They call painful micturition. He wants to pass urine, but can pass only few drops of urine. Again, he wants to pass urine. These are the symptoms, like severe pain associated with nausea, vomiting, and blood in the urine, vomitings, hematuria, stranguria. These are the symptoms of the kidney stones, and also
Now,
burning.
right. Now, when a person comes to you with these symptoms, how do you diagnose? What are the tests that are normally advised to the patient?
And one more important, when you have these symptoms, you should visit a proper urologist, whoever is available to you in the nearby locality. Because what I'm regularly seeing is uh, random practitioner where they will not be evaluated. They get admitted, they take antibiotics for 1 week, the pain won't reduce, they get MRI, CT scan, antibiotics. But the thing is, they should be properly evaluated. One have these symptoms, they should go to a proper board certified urologist who can diagnose it with this history itself without any medication. The history, the type of pain which they are feeling, once they express it, we come to understand that he has that particular problem. After that, after the clinical history is the main important thing. And after that, we do few radiological tests like X-ray KUB, ultrasound abdomen, which shows the type of location of the stone and any in the urinary tract because of the stone, any obstruction and swelling is there. We can easily diagnose. And once the confirmatory test is a CT scan before going for intervention. And also, we should also see the normal kidney function test parameters like urea and creatinine, some basic blood tests which are available everywhere. This should be done to diagnose kidney stones.
Right. And once you come to know, as you said, the placement, the size, etc., of a stone, what are the treatment options available, and what do you look forward to set the line of treatment?
Yes. There are many factors which guide the treatment of kidney stones. What we should understand is the nature is such a way that they are meant to expel the stones whichever are formed in the kidney. So for majority of the cases, provided the stone size is very small, they pass spontaneously. Only we need to give some supportive medication. If the stone size is less than 4 mm, for example, less than 4 to 5 mm, most of these stones tend to pass spontaneously in 30 to 40% of the cases, provided that the track is normal and no obstruction is there. And we give some supportive medication like analgesics or some medications to expel the stones like that. Depending upon the type of stone, location of the stone, size of the stone, which is the very important factor which guides the treatment. For large stones, which doesn't pass spontaneously with the conservative management, we need to undertake them for surgery. There are latest advances in the surgery of the renal stones. Now, no puncture need to be made, and through normal passage, we can, the lasers and recent available techniques, we can remove the stones through the normal passage.
Right.
So
Doctor,
they get proper evaluation is the key. Proper evaluation is the key.
right.
The location of the stone, size of the stone, the hardness of the stone dictates what should be done for that particular stone.
Right. So after proper evaluation, you set the line of treatment. Now,
Yes.
many times what happens, people, after the diagnosis, after the patients I'm talking about, after they are confirmed that there is a stone in their kidney, they stop taking the treatment. They'll go for, self-treatment, home remedies, other alternate medical therapies, etc. Because they feel that in allopathy, the only way to treat kidney stone is through surgery. So,
Okay.
my question to you is, doctor, many times people stop taking treatment and they'll start self-medication, home remedies, etc. What would you like to tell them? Why it's important to go and continue with the treatment?
The one thing is first get evaluated properly. Doctor only recommends surgery when there is an indication, then only you should go for surgery. If they are having a small stone, for example, 5 mm stone, there is no swelling, no pain, no obstruction, and patient is normal, we do tend to wait for a period of 1 month if he is normal. And he should be under regular follow-up. What happens in these patients mainly is what you should be concerned. If the stone obstructs and pain is there, that's a good symptom to the patient. He will come to us. If a stone obstructs and pain is dangerous, it slowly kills your kidney. If a stone obstructs and pain is not there, its swelling of the kidney will come and slowly kidney will get damaged for life, irreversible damage. So be under follow-up. If you don't go for surgery, be under follow-up. If there is a definite indication, then proceed for surgery. Surgery is only indicated when the stone size is very large, which is not able to pass through the normal tract. Other is presence of infection, presence of obstruction. Otherwise, get well with conservative medical management. And what I feel to say is this Ayurvedam and homeopathy, I am not supposed to comment, but it's their own belief. But what is these are very good in case of chronic problems, not in acute emergencies and acute infections. These things won't work. This homeopathy and Ayurveda are very good treatments for chronic problems, like long-term problems. You can go for them. But when there is fever and when there is chills, with pus in the urinary tract, these things don't work. Okay. You believe in your urologist, be under follow-up, do with conservative management, and when things goes bad or when there is a definitive indication, if you believe that, go for surgery.
And as you were explaining the complications that may result if we, don't go for the treatment immediately, depending upon the evolution of everything. We got a question from a viewer, and it is little bit associated with what we were talking about. So I'll take the question: are there any long-term complications associated with kidney stones? We have just discussed it, but still, because people mostly do this mistake of not taking the treatment, would you like to tell us one more time how dangerous it is for the kidney?
Okay. You can see the image here. This is the kidney. This is the ureter. This is the bladder. I'm telling the person, if there is a small stone like 4 mm in the kidney, you need not do anything. Take adequate water. It is enough.
Mm, mm,
If there is some stone here obstructing the ureter, the pipe, it is a very narrow one. The size of the ureter is very narrow. And if stone gets stuck here, some obstruction will be there. So this above part will swell. And slowly what happens, this back pressure will be there on the kidneys. If your water tank is obstructed in your home, what will happen? It will overflow.
mm. Right.
Same, if the water tank is obstructed due to obstruction in the pipe, and this tank will overflow and will cause the swelling of the kidney.
Mm,
Once obstruction is there, it should be relieved. Either spontaneously the stone should pass or we should remove. Or else if you neglect a stone in the kidney, nothing will happen. But if you neglect a stone in the ureter, it is going to definitely damage your kidney in the long term. It causes back pressure recurrently, and your kidney, functional area of your kidney will reduce slowly. The swelling in the kidney will increase, and whatever damage created by this sort of thing in a long term will be an irreversible damage to the nephrons of that particular kidney. So don't neglect kidney stones. If you have stones, get regular checkups, be under follow-up, and if nothing is there, be under follow-up. If it is indicated and it's damaging your kidney, go for particular intervention suggested by your urologist.
now, doctor, can in long run, if the stone is still there, but can it be asymptomatic? For example, the patient is not anymore feeling the pain or nausea, etc., and
Yes,
imagining that maybe I have, flushed out the stone, but is
yes.
there a chance that it's still there asymptomatically?
Definitely. That's what I have mentioned earlier also. A kidney stone can be asymptomatic, and
Mm,
that particular kidney stone is more dangerous than a symptomatic kidney stone. Why? Because if you have symptoms, you will attend my office
right.
so that you will be evaluated and diagnosed earlier and treated earlier. But if you have an asymptomatic kidney stone, you won't attend the doctor's office. It will cause damage to you on long term, and they present with renal failure and other at the long and the last event they produce. If you have kidney stones, there is some chances of recurrence of kidney stones in 10 years. So once a kidney stone patient, you should be under regular follow-up every 6 months or 1 year with their particular urologist and doctor. So kidney stones can be asymptomatic, but once you have stones, be under follow-up so that it won't cause permanent damage to your kidneys.
Mhm. Again, a very related question with what we are just discussing. Rohit, his question is: how often should I undergo medical evaluations to monitor my kidney health and prevent future stone formation?
The question. Uh, what I suggest is for a young person who doesn't have kidney stone, he doesn't need regular checkup and follow. once in a while, once in his family, once in his yearly checkup or once in 2, 3 years, he can get it done. If you do have a family history of kidney stones, that means the same food and genetics, you should get evaluated every yearly. Once you are a patient of kidney stones, then definitely you should regularly get your creatinine done and also imaging done frequently depending upon the recurrence of your stones. If you don't have recurrence for 1 year, you can get yearly or once in 2 years. If you get recurrent kidney stones, you should have the shorten the evaluation period depending upon the need. And patients with obesity, recurrent infections, regular kidney failure, metabolic disorders who have chances of forming kidney stones should be visit the office once in 3 to 6 months.
Right. I'll take one more question from Feroz Khan, one of our viewers. How can I determine if my kidney stone is a recurring issue or a one-time occurrence?
Uh, it varies from person to person. Kidney stone is not a one-time issue. Most of the kidney stones will have 50% recurrence in a period of 10 years. The kidney stone farmers tend to recur 50% chances to tend to recur for another kidney stone in a period of span of 10 years. So once you have a kidney stone, and it might be due to some dehydration or something, you may not form a new stone in the next 4 or 5 years due to particular dehydration or some symptom. If you should get proper evaluation of your these what are other medical conditions. He has infection or any anatomy disturbance in the anatomy of the kidney which causes kidney stones. He has more uric acid levels which form kidney stones. These all factors play important role. You should get your metabolic evaluation and stone analysis done after the surgery so that we can understand what is the cause of your kidney stone, and then we can suggest accordingly. If you are a very young person, you have small 5 mm stone and no other stones in the kidney, you get it cleared, it passes off, there's less likely you forming a new stone in the next 5 years. You are an old person, diabetic, already having 5 kidney stones on right side, 5 kidney stones on left side, you tend to form more frequent. So it depends your age, your metabolic condition, other factors like infection, obstruction, what all I spoke. So that is the thing.
In general, we get to hear so many advices once a person go through or have this kidney stone that, stop eating spinach, stop eating tomatoes, or so many
Yes.
things are there. So are these like umbrella, thing that everybody who ever had stone need to follow this, that stop having spinach or other vegetables with seeds, etc.?
What I need to suggest is for a person with kidney stones, don't stop eat anything. Limit the things in your food. Limit. Don't stop. You should stop everything. You should stop non-veg. You should stop nuts. You should stop tomato. You should stop spinach. You should stop chocolate. You should stop soda. Stop everything. That's not the thing. Limit the intake of these things. And the tomato and spinach concerned, these things are explained in the Western literature, where they are more tend to eat more of salads in non-cooked form. They tend to cause more of kidney stones. We Indians do consume these things after cooked. We cook and make curry and eat these things. So the chances of forming a kidney stones in cooked diet is very less. So these things we don't tend to understand is a simple word used by different people. More of these people on YouTube and everywhere, many people give these suggestions to stop eating everything, limit the intake, know the cause of the kidney stone, act accordingly.
Okay.
And another
We have
important thing,
Aman
what
with
I
us,
want
a
to tell is
viewer.
limit the
Yes, sir.
intake of salt. Limit the intake of salt. There is a complex thing which we need to explain. More intake of salt causes more of calcium kidney stone formation. You should take adequate dietary calcium. Intake of adequate dietary calcium in the form of milk, curd, paneer don't cause kidney stones. more intake of salt causes kidney stones. That you should remember.
Okay, because otherwise people feel that if they are having calcium, stones,
Causes
that
calcium
means that
stone
their
formation.
calcium
No,
intake
no.
is more and they
Don't
start
take
to.
calcium supplements.
Right.
Take dietary calcium, natural dietary calcium. That's more important.
Okay. So Aman is here, and his question is, how do I differentiate between kidney stone pain and other abdominal discomfort?
Okay. Uh, you have some minor abdominal discomfort. The kidney stone, what I explained, the pain in kidney stone is in a spasmodic pain, severe pain, which comes in cycles. It comes for 2 minutes, it stops. After 1 hour, 2 hours, again it comes. That spasmodic, excruciating pain will be there. And the pain due to other infection or gallbladder infection, appendix is continuous. Pain will be there all the time. That is the main difference which you can appreciate. And you have discomfort for more than 1 day, you should visit your doctor to diagnose if it's an emergency or other kidney stone, and you can't diagnose by yourself. Once you get pain of kidney stone, you will remember it for lifetime and you will diagnose yourself the next time.
Definitely. We have Venkatesh Iyer and his question, though we have already discussed it, but maybe Venkatesh have joined our session a little late. So his question is, are there any genetic factors that increase the likelihood of kidney stones? And with it, I would like to add, doctor, in case there is a family history, what can we do to prevent or prolong it?
No, there are definitely some genetic factors associated with kidney stone involving the complex metabolisms of certain things. The cystine stones, which are commonly seen genetical problems, which are involved in the metabolic cycles of that particular things. So, uh, when there are some genetic problems, you should get them treated to prevent the kidney stone, recurrent kidney stone formation, if some treatment is available further, or avoid some particular diet which involves the formation of that particular uh, minerals or something that will be suggested by your doctor. Once you have the family history of the kidney stones, you can't diagnose it, it's genetic, but you should be under regular evaluation and metabolic follow-up so that whatever is needed will be done by your doctor.
Right. Now, one thing that we are continuously talking and emphasizing on is having adequate liquid consumption. Now, my question to you, doctor, is it just water, or there are other things which we can, count in our liquid consumption? What are these? Do coffee or tea also comes in it? We can count it as our liquid consumption, because in our society, many people are so much dependent on these, tea, coffee, etc. So, what is
Okay.
the definition of liquid consumption?
Liquid consumption means main thing is water.
Hmm.
It might be coconut water, buttermilk. Uh, these are the fruit juices you can take. Cranberry juice is more useful, which contains water and also prevent formation of the kidney stones. These are the various liquids which you should now take. You should not take soda is also water. You can't take soda. You can't take alcohol. Tea, coffee, limitedly you can take. Nobody will. It won't cause kidney stones. You take proper water. When you're going in the heat, take adequate water. When you're staying in home, take coffee, take adequate water. Nothing will happen. When you go out and roam in the sun, you take more of water in any form.
Right. Now, again, because summers are here and it's scorching heat out there. Now, what is the right way of consuming water? Because there are set of people who will have like 1 liter of water at one go. They'll start their day with 1 liter of water, end their day with 1 liter of water, and won't have anything in between. Then there are people who take, small sips of water. So, what is the right way?
What is suggested is the total urine output. What is the 24-hour urine output is the key.
Hmm.
24-hour urine output should be 2 liters to prevent the formation of stones. Keep this aside. Whenever you wake up, take lukewarm water. Lukewarm water, 1 liter you can take. And by afternoon, you can take another liter. Finish it before your 1 to 2 hours before your lunch. You can do another 1 liter in the office time. And after your lunch and nap at around by 6 o'clock, you can take another liter. While going to sleep from 7 to 9, you can take another half to 1 liter. Elders should avoid taking water after 5 p.m. because they tend to go frequently to the urine. That will be the another problem for the elderly age group people. They can take this adequate water intake before 5 p.m. and avoid things like water, alcohol, coffee, tea, bladder irritants, everything, soda. After 5 p.m., they should avoid because otherwise they tend to wake up in the night, which cause the sleep disturbance. Young persons can divide accordingly and take this 3 to 4 liter of water.
Right. Now, doctor, because when we were discussing the treatment options, you said there are, lifestyle modifications, medical management, there are certain procedures, techniques, surgeries. My question to you, if a person is going through the procedures or laser or surgeries, how much time they need to recover? What is that time?
Earlier, what used to happen is these kidney stone surgeries used to be open surgeries. They need to cut the tissue and open. Later, some laparoscopy came for big stones in the kidneys. Now, what is happening is these kidney days surgeries have become a daycare surgeries. It's like 1 day admission. Due to the miniaturization of the instruments, the small instruments have come, which goes easily through your urinary tract into the kidney. They go through all the way, they go from the urethra through this pipe into the kidney and blast the stones there into small powder, which passes off through the urine. These are the latest advances. They call RIRS, that is retrograde intrarenal surgery, which has come into limelight for the past 10 years. It is there, but recently this is the most common surgery being done, where you use the laser to make the stone into powder so that it passes through the urine, and the very next day patient can be discharged.
Right.
And some kidney stone surgeries are there where they make a hole in the back, that is called PCNL, and they blast the stone and remove. That there are chances of some bleeding. Some admission might be there for 2 to 3 days, depending upon the size of the stones. If the size of the stone is too big, that should be done. If the size of the stone is average size of the stone of 1 to 2 centimeter, it can be dealt through the normal urinary tract with these latest advances. Anyhow, stone surgeries have become daycare surgeries these days, and whatever may be the size of the stones, you will need maximum admission of 2 to 3 days.
And then they can get back to their work in
They
few
can
days.
get back to their normal work the very next day.
Okay.
There is no need for bed rest.
Okay. Now, anything that we are missing out on while discussing kidney stones, doctor? Anything that you have observed in your patient and you would like to take the advantage of this platform to, enrich our viewers?
Only thing what I want to say is kidney stones are very good stones. They won't harm you unless you neglect them. Don't neglect. If you have a stone, don't neglect it. Most of the stones pass spontaneously by nature. One thing what I feel bad is some patients know they have stones. They are feared about going for treatment. They will come to me every 2 months, get the scan. Will some it will be reduced on ultrasound. They tell it has reduced, sir. Yeah, I'm happy. Like that. No, you should get surgery, I will tell. They will come recurrently but won't undergo surgery. The thing is, if there is indication, better go for surgery because you'll be normal from the very next day. The more the kidney stone is there in your body, it causes more infections, more of infections and other complications. Stone is lot of bacteria will be there in the stone. You have a recurrent UTI and everything. The stone, adequate large stone, there is no other possibility than undergoing surgery, which the patients
What is the definition? How do you differentiate a small stone and a large stone? What is the
Yes, the
standard
very
mark?
interesting question. And the small, large depends upon on the location of the stone. For
Okay.
example, a 3 mm stone in the kidney. Nothing you should do. Drink water and relaxedly you sit in your home. 3 mm
Hmm.
stone in the kidney. 5 mm stone in the kidney. Drink water, take some medication, sit in home. 7 mm stone in the kidney. That means here,
Hmm.
this location. No need of surgery. You take water and sit in home. 5 mm stone in this pipe, ureter. The pipe which you are seeing. If you have no pain, take medication. Most of the times the stone will pass spontaneously. If it causes obstruction, then only you need to intervene. If it causes obstruction, pain, fever, chills, blood in the urine, the symptoms are there and it's not passing spontaneously through the normal tract because the below area might be narrow. Whatever medicine you take, whatever you do, it won't pass. Then intervene.
Right.
It's a complex thing to explain, but
Hmm.
roughly less than 5 mm stones, you need not do anything most of the time. If
Hmm.
stone is more than 8 mm, you need mostly you may need intervention. But if you are lucky enough, 1% of the time that 8 mm stone also might pass. But 99% of the cases, if stone size is more than 8 mm and gets obstructed in the tract, you need intervention.
Right. I think the bottom line is please do not ignore the symptoms. Pain is so severe that you can't. So you'll have to
Definitely.
go and get it checked. But also, after it is certain that it's a stone, this is the size, please do proper follow up. Trust your doctor. Go
That
by
is the
what the
most
doctor is
important.
advising you. That's really important.
Yes, yes.
Doctor,
And
with
the
what you
bottom line,
just
what I want to say, asymptomatic stones are more dangerous than symptomatic
right,
stones. So
right,
proper follow-up is the key.
is the key, right? And after from what you just explained throughout the session, I can also make out the that UTI can also cause stone, and stone can also cause UTI, right?
Definitely, definitely.
Hmm. And UTI
There
will
is
lead
another
to
there is another thing involved.
hmm.
Obstruction in the urinary tract can cause both UTI and stone.
Oh, okay.
Obstruction in the urine, male having prostate,
Huh.
what happens? Obstruction will be there. Urine won't pass freely. So there is stock of urine in the bladder because some urine is remaining in the bladder. That remaining urine will be there for a long time, which will cause nidus for stone formation. So anatomy of the urinary tract and obstruction of the urinary tract is also the important cause of infection and stone formation.
And doctor, before we sum up the whole session, any take-home message for our viewers?
Enjoy your holiday, enjoy your summer, drink adequate water, stay at home. The temperatures are too hot in our area, especially along with humidity. Most
Hmm.
of the patients are being presented with heat stroke than stones.
Hmm.
So, hydrate yourself, enjoy
Yeah.
it.
Yeah, keep yourself hydrated and remember all stones do not need surgeries, and even if it needs surgery, there are so many advancements in surgeries these days that it will be done, and of course it depends
Yes.
upon a good doctor. So what you need to do is to find
Most
out a good qualified urologist. That's it.
most of the stones doesn't require surgery. Not
Hmm.
all the stones.
Yeah,
Most of
most
the
of the
stones,
stones, right?
70% of the stones presenting these days due
Huh.
to the increasing in the imaging technology. Ultrasound and CT is available everywhere. So most of them are getting diagnosed in the early stage and they're being treated and most of the stone doesn't require surgery. Only thing what I am going to tell to the audience is attend a board certified urologist. Attend a board certified M.Ch urology should be the proper degree of the doctor who treats the stone. What I have
Right.
regularly seen is most of the people come with stone and infection. they treat it for 20 days bedside by some quack or somebody. They present in the last stage fever and these things, which might, with simple digestion, might relieve that infection and pain, which is in half a day he can get discharged. So
Right.
anything, go to a proper board certified doctor.
Right.
So he guides you
Absolutely
properly.
true. Yes. Thank you so very much, Dr. Arjun Prakash. It was wonderful talking to you. Thank you for your valuable time and making this session a very informative one. Thank you so very
Thank
much.
you. Thank you very much.
And viewers, thank you for your excellent participation. For more information and updates, stay connected on our FB page, Prostate Wellbeing. We are also available on YouTube, Twitter, and Instagram. Thank you. Have a good day. Goodbye.